Yeah, hello everyone. I'm Dr. Rakhi. So I was supposed to speak against Dr. Amit for he was talking on offline conferences, and I'll be talking on online conferences. So COVID-19 has led to a paradigm shift in the practice of medicine, and interest in online webinars and classes grew exponentially, mainly during that time. And it was mainly because it gives the audience the luxury to pick and choose which webinars they wish to attend. So now today I'm going to give you 10 reasons to vote for online conferences bar webinars. Coming to the cost effectiveness, in an attendee's perspective, there is no need to pay huge registration fees, no need to charge for travel and accommodation. They can attend multiple conferences a year as the budget was not compromised. No dressing up needed, no need to buy expensive suits and saris. Coming to the organizer's perspective, there is no cost for the venue, no catering, no food expenses. Hence, there will not be any mass food poisoning or casualties. Less expenses for audiovisuals, no printing or banner charges. Coming to the second point, that is the participation. The delegate participation has increased fourfold as per the studies when virtual conferences came. There was no limit in the number of audience or hall capacity. Diverse audience from different locations and different countries participated. The number of international speakers also increased twofold. And the main point, women empowerment. Two separate studies revealed that online events held during the pandemic resulted in increased participation among the women, both as attendees and as speakers. This is because women are multitaskers, so they were able to manage the household chores as well as they were able to attend the conferences online. Coming to the interaction, there was more robust participation and exchange of ideas, especially because of the chat functionality which is available with Zoom platform. And this also helped to exchange the ideas effortlessly because the webinars allow the participants to interact with the presenters during the live streaming itself. And this was considered to be a better opportunity for introverted people to ask questions or to participate as speakers also. People with stage fright or difficulty in speaking in public can also anonymously use the chat functionality to ask their doubts or give their opinions. Time saving. There was no need of getting leave approval from institutional heads, no loss of pay for you. The talks were all of short duration, hence there was more attention from the attendees, saving the pre-conference and post-conference travel days, less fatigue, and less chance of communicable diseases. And you can watch any time at your ease, and you can even have a coffee or a snack in between for refreshing your mind. Coming to the residents' perspective, there was a change in the didactic lectures and case presentations to more active video-based classes, and residents even started participating in journal clubs when the online conferences and webinars came. And all the residents learned out to make impressive PowerPoint presentations, and they started utilizing technology. And this online conferences and webinars also helped to bridge the teaching gap which is present in various PG institutions in India. And the residents became more aware of the e-learning sources. Thus, Gupta et al. Said that because of the role of the webinars, the learning experience of ophthalmology residents have become almost 3/4 of them welcomed this as a very good academic tool. So there was a paradigm shift in the teaching. So as we all know, whenever a new platform comes, there will be many negatives which will be pointed out. But if we keep on looking at the imperfections, we will miss out on the plus points. So the educational goal of this online learning is not to replace the conventional hands-on experiences you get at conferences or the surgical training, but to improve the knowledge and to be updated in the recent advances. Thank you.
Thank you, Dr. Rakhi. I would want to ask the views of the panel, and we have a couple of minutes, so one point is from each. Dr. Aarti, from you.
So, since Dr. Amit is not here, let me just say a few points in his favor. I feel that there is a big role of physical conferences. It's not that we have too much of time to see the recordings. I'll ask people sitting over here that how many of us do that. Okay, fine, this was an interesting conference, I was not able to attend, but let me see the recording. It doesn't happen. But when you are in the conference, you are forced to sit here and hear what is happening. Take home points definitely will always remain in your mind because you are physically present over here. The second thing which is against the online thing is, if in case you are at home, you'll end up doing a webinar at 8 o'clock, 10 o'clock in the night. And then you may find your partner or children complaining about that you are bringing your work home. So you don't want that to happen. You don't want to compromise your family time. You don't want to mix two of them. So if in case you are gone for AIOC to Kolkata for 5 days, your family has assumed that you are not with them. They are mentally prepared for it. But if in case you keep on doing webinar every week or every third day, over a period of time, you are actually compromising their life as well along with yours.
So I absolutely agree. Both of them have pros and cons, but yes, definitely physical conferences do have an impact on us in terms of the attention spans and also more dedicated and focused learning. So I would be like biased towards physical, but about other things.
I feel it depends again, because if it's a long conference like 4 to 5 days like AIOC, it should probably be physical, because I know doctors in Kolkata who are in clinic and who will be here for their own talks, because it's difficult to prioritize time just for the conference unless you are at the venue. But if it's small ones, it could be hybrid, or even if it's 1 hour one, it could probably help us prevent the commute and harming the environment commuting just for a 1 hour thing, and it could be online. Thank you.
Dr. Ashish, if you can say something. Or I'll conclude saying that, depending upon the content of what you're presenting, sometimes the content doesn't require any extensive detailing, and that can be done online. But I think physical meets do have a very different impact, and the way you present and what you're presenting, people, if they have better attention span. With this, I think we can close. We thank you, Dr. Rakhi, for doing it. And I would want all the speakers and the panel people, if you can come up, and we'll take a group photo and we'll call it an end. Thank you so much.